Abductor pollicis brevis. The patient is asked to abduct his thumb against the examiner's resistance. The abduction is done in a plane at a right angle to the palmar aspect of the index finger. Opponent's pollicis. Ask the patient to touch the tip of his little finger with the point of his thumb. Oppose the movement with your thumb or index finger. Interossei and lumbricals. The patient is asked to flex his metacarpophalangeal joint and to extend the distal interphalangeal joint against the examiner's resistance. Flexors of finger. The patient is asked to squeeze the index and middle finger of the examiner. Flexor digitorum longus helps in the flexion of fingers. The index and the middle finger is sufficient to assess the grip without crushing. Flexors of wrist. Ask the patient to bring the tip of his finger towards the front of his forearm. Flexor carpi radialis helps in the flexion of wrists. Extensors of wrist. Extensor carpi radialis and extensor carpi ulnaris helps in the extension of wrist. The patient is asked to make a fist and to flex the wrist against the examiner's resistance. Brachioradialis. The arm of the patient is placed midway between prone and supine position, and then he is asked to bend up the forearm while the examiner offers resistance. Repeated on the other side. All the limb examination needs to be done on both sides. Biceps. The patient is asked to bend up the forearm against resistance with forearm in full supination. Triceps. The patient is asked to straighten out his forearm against the examiner's resistance. Supraspinatus and deltoid. The patient is asked to lift his arm at a right angle. The first 30° is carried out by supraspinatus and the remaining 60° will be carried out by deltoid. Repeat it on the other side. In the upper limb, we have assessed the power of the following muscles. Testing the power of muscles of the trunk. Pectoralis major. Ask the patient to place his hand on the pelvis and to push it down. If the muscle is contracted, power is normal. Latissimus dorsi. Ask the patient to straighten out his arm at 90° and push it against the examiner's resistance. If the muscle is contracted, the power is normal. All the examination needs to be done on both sides. Muscle of abdomen. The patient is asked to sit up from a supine position without the aid of his arm. Trapezius upper part. The patient is asked to shrug his shoulder against the examiner's resistance. Trapezius lower part. Ask the patient to approximate both the shoulder blades. Testing the power of muscles of lower limb. Plantar flexion. Ask the patient to depress his feet and toes against the examiner's resistance. Gastrocnemius and soleus helps in plantar flexion. Dorsiflexion. The patient is asked to elevate his feet and toes against the examiner's resistance. Tibialis anterior helps in dorsiflexion. Extensors of knee. Bending the patient's knee, press your hand on the shin and ask him to straighten it out again. Quadriceps femoris helps in extension of the knee. Flexors of knee. Ask the patient to bend his knees against the examiner's resistance. You can also support the thigh with your one hand and hold the ankle with the other. Hamstrings muscles helps in flexion of the knee. Flexors of the thigh. With the leg extended, ask the patient to raise his leg off the bed against the examiner's resistance. Iliopsoas helps in flexion of the thigh. Adductor of the thigh. Abduct the limb and then ask the patient to bring it back to the midline against resistance. Adductor magnus, adductor longus, and adductor brevis helps in adduction of the thigh. Abductors of the thigh. Ask the patient to separate his legs against the examiner's resistance. Gluteus medius and gluteus minimus helps in the abduction of the thigh. For the lower limb, we have assessed the power of the following muscles.